this actually real? Well, if you've ever experienced it, you would know it is. The formal name for this is seasonal affective disorder, and some would call it winter depression, but the problem with that is it doesn't always happen during the winter months. But the most common of these would be the winter depression or the seasonal affective disorder that happens during the winter months. It's usually characterized by a unipolar depressive episode that happen during the winter months and then resolve when the spring and summertime come about. So you may be asking yourself, well, if it's just going to go away when the spring or summer comes about, why should we even bother about trying to figure out how to treat it? The reason being is this could be very difficult for people and it can alter their everyday living. In addition, it's also associated with psychosocial impairment, and there is treatment options that are pretty effective. So the great thing is if we get a diagnosis and we find that the treatment is effective, then we can hopefully avoid it in the coming seasons. So how common is this? The lifetime prevalence is somewhere around 3% of people will experience this at some point during their lifetime. Truthfully, risk factors for seasonal affective disorder are kind of hard to pin down, so we're not going to discuss those in great detail. Also, the pathogenesis or the reason this occurs is not well known either, but there are a couple different theories and hypotheses. The most common theories would be a disruption in our circadian rhythm, changes in different neurotransmitters throughout the seasons, and potentially different genetic factors. So what would be the symptoms of this? They would be the same as major depressive disorder. You can see a list of them right here, but they would have seasonality to them. Now, when should someone suspect that they have this disorder? It would generally be that maybe their depressive symptoms become much worse during the winter months, or once the sun starts shining, those depressive symptoms go away. Now, it is important to know that it isn't just the winter months, that you can have the opposite of this. It's just less common, meaning you're more depressed during the summer. So how is this diagnosed? It's based upon the DSM-5's criteria for seasonal affective disorder. That would be that you have recurrent episodes of major depression, hypomania, or mania with the seasonal onset and remission. And so how is this treated? The primary therapies would be psychotherapy, light therapy, and antidepressants. And some good adjuncts to this treatment would be walking outside, getting daily doses of sunshine, proper sleep hygiene, and enhanced indoor lighting. So yes, seasonal affective disorder is a real condition and can affect a lot of people. I'd love to hear down in the comments if anybody has ever experienced this.